Microbes. Teeny tiny microorganisms that inhabit us and cover every surface that we see and touch. Mostly, we think of microbes as harmful little guys that infect us and make us feel bad. But in fact, we need these microbes in us and on us in order to remain healthy. So, what happens when our healthy microbes are being killed off? I want to create awareness about the antimicrobial stewardship movement, which works with doctors to cease the overprescribing of antibiotics and help keep our normal flora. First, a little history on antibiotics. It was in 1928 when Alexander Fleming first created the first true antibiotic, penicillin. And from that point on, antibiotics have been a useful tool in helping to treat ailments such as strep throat and pneumonia. But beginning in 1947, the overproduction and overprescribing of penicillin led to the first known case of antibiotic resistance. And the unfortunate fact is that most of us will be admitted to the hospital at some point in our lives. And annually, 1.7 million patients acquire a nosocomial or hospital-acquired infection during their stay. So, we get one of these infections, but we are not able to treat it with normal antibiotics. Where do we go from there? Antibiotic resistance is the ability of a microorganism to withstand the effects of an antibiotic. When a person takes an antibiotic, the drug kills the defenseless, healthy bacteria, leaving behind the bacteria that can resist it. These renegade bacteria then multiply, increasing their numbers by 1,000,000-fold in just one day, thus becoming the predominant microorganism in our bodies. Disease-causing microbes thwart antibiotics by interfering with their mechanisms of action. For example, penicillin kills bacteria by attaching to their cell walls to destroy a key part of that cell wall. When the wall falls apart, the bacterium then dies. Resistant microbes, however, alter their cell walls so that penicillin either can't bind to the cell wall or they produce enzymes that dismantle penicillin itself. Antimicrobial stewardship is a coordinated program that promotes the appropriate use of antimicrobials, including antibiotics. This improves patient outcomes, reduces microbial resistance, and decreases the spread of infections due to multi-drug resistant organisms. This means promoting the selection of optimal drug regulation, dose duration of therapy, and route of administration of these antibiotics. Antimicrobial stewards seek to achieve optimal clinical outcomes related to antimicrobial use. They want to minimize the toxicity and other adverse effects of antimicrobial use, reduce the cost of healthcare for us when we get an infection, and limit the selection for antimicrobial resistant strains. Hippocrates said, "Declare the past, diagnose the present, and foretell the future." The antibiotic stewardship movement is working towards those goals. We declare the past as a learning experience. We diagnose the issues of the present, and we foretell the improvements that are coming in our future. I don't think that anyone thought that the overprescribing of antibiotics could be potentially harmful. But now that we know the consequences, we should all be more proactive in working with our healthcare providers to make this world a healthier place for us all. Thank you.